Good evening and welcome to our clinical presentation, Spring 2025. My name is Olivia Neal and I did my rotation this year at Nashville General Hospital, which is located at 1818 Albion Street in Nashville, Tennessee. So let's get started with the introduction to Nashville General Hospital. Nashville General Hospital is a healthcare facility located in Nashville, Tennessee. It is actually only about 8 minutes from downtown Nashville. It is a city-owned hospital in a level 3 trauma center, and it is over 350,000 square feet with 150 beds, and it is also an 11-tower facility. Next, we will be going through the services provided at Nashville General. So here is a list of all the clinics and services, and I will read them out. So you have the breast health, community pharmacy, emergency medicine, endocrine, ENT, eye clinic, family medicine, foot and ankle surgery, gastroenterology and hepatology, general surgery, gynecology, heart and vascular clinic, hematology and oncology, hospitalist services, internal medicine, internal radiology, men's health, neurology, orthopedics, outpatient imaging, primary care, pulmonology, renal, rheumatology, urology, and women's health services. So as you can see, they have a lot of services and clinics to provide for their patients. All right, so now we'll go over the medical staff bylaws. So the medical staff bylaws of Nashville General Hospital establishes the policies and procedures that staff must abide by with the aim of maintaining the highest of standards for the hospital. So a little section from the bylaws state, for the purpose of these bylaws, the word medical staff shall be interpreted to include all physicians as defined in Article 3, Section 2B, who are privileged to attend patients in Nashville General Hospital at Meharry. The organized medical staff develops and enforces the medical staff bylaws, rules and regulations, and policies by recommending action to the governing body, Board of Trustees, in certain circumstances, and taking action in others. The Board of Trustees, in turn, upholds the medical staff bylaws, rules, and regulations and policies that the board has approved. All right, moving on. So here we have Nashville General Hospital's mission and vision. So their mission is to improve the health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers, and translating science into clinical practice. Their vision is really just to be a leader in exceptional healthcare for all. And going back to the mission, we actually saw resident physicians doing their clinicals at NGH. So supporting tomorrow's caregivers, I do believe they take that seriously because they take on a lot of volunteers, interns, and resident physicians, which I think is great. All right, so now we'll get into the Health Information Management Department. So the HIM director is Yasmin Wood, who is certified with her RHIT. And the HIM department is a team made up of 11 people, which includes 3 HIM analysts or specialists, 1 chart and prepping personnel, 1 release of information personnel, the HIM director, and 5 offsite coders. The Health Information Management mission is to ensure documentation is completed timely and accurate, and their defined time frame is 72 hours within discharge, and maintaining an unbilled goal of 3 days, which is important. So making sure that after discharge, everything is billed after 3 days and not exceeding that. All right, so here is an HIM specialist job description up at the top. So kind of what they're looking for. So education-wise, they require an associate's degree in RHIT and or RHIA or equivalent experience in health information management. For licensure and certification, an RHIT or RHIA is preferred. The experience and knowledge, so they would need to have basic computer and clerical skills, including keyboarding, experience with Microsoft Outlook, Excel, and Microsoft Word, the ability to work independently and exercise judgment in new situations, and 1 year of previous clerical experience, knowledge of medical terminology, Microsoft Excel, and Microsoft Word preferred. And I actually got to speak with the HIM director, Yasmin, about how they go through the process of hiring someone for their HIM team. So first, what she would do is go to their HR resource, which is human. And after she kind of puts in the request for a new team member, a recruiter will come in and talk to her and see exactly what she's looking for the position. The recruiter will then go and post the job information and resources to obtain candidates for the role. So the initial meeting for a possible hire is done first with the recruiter to see if they meet the qualifications. And then the director or Yasmin would conduct a second interview while reviewing their application for the position and their resume. And so if indeed they do want to move forward with that candidate, then they will update the candidate's status in their system to the position that they just got, and then go ahead and schedule training and when they're going to start and all of that. So I thought that was kind of cool how she told me the steps of how they do that. Right, getting into the EHR system used at NGH. So Cerner, which is a pretty, I want to say pretty popular EHR system, was actually just implemented. So it is a new system for them. They just started using it on December 16th, 2024. So as it is a new system to the hospital, of course, they are working out kinks within that system. So we got the opportunity to attend meetings with the Cerner and the HIM team at Nashville General, where the Cerner representatives assisted the HIM departments with issues such as discharged patients not transferring to the coding queue. So just kind of troubleshooting those kinds of issues and those kind of kinks that they're still trying to figure out. Okay, so now we're going to get into some of the tasks or just kind of daily things that the HIM team works on. So first off is going to be their deficiency analysis. So the HIM team is responsible for doing monthly audits on deficiency analysis. They work on this every day by going through medical records and ensuring that they are complete. If a medical record is not complete, they must add a deficiency, which makes a note in the medical record for the doctor to complete it. When it comes time for the HIM personnel to complete the report, they choose 30 random medical records, so 10 from the emergency department, 10 from the outpatient department, and 10 from the inpatient department. And so what they're doing, or what they're looking for rather, is to make sure that they have a history and physical completed, emergency department history and physical, the discharge summary, consultations, clinic records, progress notes, physician orders, operative record, endoscopy reports, cath reports, and physician queries. So they're looking for all of that to ensure that it is in the record and it is completed. So they also look for missing signatures, which must be signed by the physician, and they cannot be signed by the resident physicians. So notes and system triggers are marked as visual aids in the medical records, so the physicians can recognize it as a deficiency and then complete it. All right, so this slide kind of goes hand in hand with the last. So this is kind of the analyst guide that they use to do their deficiency analysis. So the HIM specialists are assigned a task to complete for reviewing discharge accounts to ensure that all appropriate documentation is in the chart and assigning deficiencies for any outstanding items. So as we can see here, there's a list of questions that they have to go through each chart that they select for those monthly audits. So the questions are, is there a timely history and physical in the record? Is the history and physical updated 24 hours prior to surgery? Are all elements of the history and physical present? And you can kind of see how they put, how they list everything that should be in the history and physical just so they don't miss it. Continuing, is there an admission order in the record? Is there a complete and timely discharge summary in the record? Are the discharge instructions present in the record? Are the discharge instructions signed by the patient? Are general consents to treat the patient in the record? Are informed consents related to the procedure present in the record? Are appropriate operative reports in the record? Is the procedure note or operative report dictated within the allotted time frame? Is physician handwriting legible in all reviewed documents? So they go through this list, abiding by the rules that you can see on the right hand side to make sure that everything is not only complete but also compliant, which is very important. All right, moving on to the physician side of this. So anytime a provider has not signed or completed a patient's form, a deficiency will pop up in the system. So at that time, the HIM director will send a delinquency letter as shown below. And once the provider has received 3 of these letters or warnings, they are considered suspended. So the first little letter on the left is the first delinquent medical records notice. So the HIM director will send this out to a physician if a record remains incomplete for longer than 72 hours. So they will receive this first notice. A week after, if they still have not completed what needs to be done, they will get a second notice. Along with, if they haven't completed it during the 3rd week, they will get a 3rd notice. And that is their last warning. So if by the 4th week they still have not completed what needs to be done in the record, then they will be suspended. So at NGH, that means that they cannot get any new patients, and they can only care for patients that are already in the hospital or in the case of emergency admission. So it's really important for physicians to complete those records so they aren't suspended and not penalized for that. All right, moving on. This is when I sat with one of the HIM specialists, and her name is Crystal. So she kind of showed me how she works through her workflow queues. She does the same-day surgery, the outpatient, and the imaging. So what she did was she went into Access HIM, which is the queue, that the coders use. So she can see if they have noted anything, but everything in that queue has not been coded for some reason. So what she has to do is she has to go into PowerChart, which is the EMR, and look up the patient specifically by encounter and find out why that encounter has not been coded. So once she can see if everything under that encounter is completed or not, then she can make a note for the coder, such as waiting for physician signature. Now, if that physician signature was there and that record was completed, then she would change the status in the workflow queue from pending to completed, which therefore pushes it to the coder's queue so they can go ahead and code it. Another thing that me and Crystal, an HIM specialist at NGH, talked about was hospital form creations. How does that happen? And Crystal is actually the one that does it. So first, the form request would have to be received by her. So then she would go in, create the form with everything that the certain person requested on that form, and then she actually makes a specific barcode for that form. So after she does that, the form will then need to be sent over to the forms committee to be approved before it becomes an official hospital form. Okay, moving on to birth certificates. So the birth certificates were not originally prepared by the HIM department, but they are now taking them back over. So after a baby is born, the birth certificates must be completed before 10 days, and they are filed with the Tennessee Office of Vital Records. The system that Nashville General Hospital uses for both birth and fetal death certificates is called VRISM, and birth and fetal death certificate drafts are kept for a couple of years by the birth certificate office. So we actually got the opportunity to go up with one of the HIM analysts, Stacia, and see how they're kind of adapting the birth certificates now that they are doing them. So we got to go up there, and there was actually some parents of a baby that had been discharged from the hospital before the birth certificate was completed, which is not common. They did not speak English, so we got to see how Stacia used the translator system via phone that they use. Unfortunately, the mother of the baby did not have a valid license, passport, or other state-issued ID, so they were unable to complete the birth certificate. But it was kind of cool how we got to see the process of them using the translation phone and having someone on the phone to be able to speak to the parents. And I think that was pretty cool. All right, moving on, we got to sit with Nancy, who is a part of the admitting department. Um, we actually did have a patient come up to her and ask her about a bill, and of course she doesn't answer questions about bills because that is not under her job description, but she did get to tell us what kind of bills they have at NGH. So the physician bills is a team health bill. The Nashville General Hospital bills is a facility bill, and then the hospital bill is labs, ultrasounds, x-rays, anything like that. And then we got to see which kind of application she used to do the admitting. So for registration, she used the app bar application. She also showed us the patient portal, which is called Health eLife. And then she also showed us how to run the information in the Next Bar application. All right, the last person that we sat with for our clinical experience was Mark, who is the director of patient accounting, and he just kind of went through, what he does. He is in charge of all hospital bills, and his kind of daily to-do list includes view unbilling reports and average daily revenue, track ER volume and audits, track cash collections, track coding queues, and follow up with departments. And so his main goals as the director of patient accounting is to get bills out of the door, answer patient questions about bills, and find out how different departments can improve. All right, so some important notes and highlights from my clinical experience at Nashville General. First, they have this financial aid assistance program, which I think is pretty cool. So anyone who is low income or it's hard for them to pay for procedures, office visits, anything like that, they can apply for the financial assistance. And once they're approved, they get a little card, and it ranges from January 1st, 2025 to June 1st, 2025. It's a 6-month period in which they can receive any treatments, any clinical visits for free, which I think is really great. Another cool thing they have is there is a hospital discount applied to any Davidson County resident that goes to that hospital, which I thought was kind of cool. And then lastly, they have a program called the Nashville Healthcare Incentive Program, and that is actually for any Metro employees. So any Metro employee is incentivized to use Nashville General at almost a 0% cost. It's very low. And so I thought that was kind of cool that they do that for their not just employees, but anyone who works for Metro, which I thought it was cool. So any police officers, firefighters, anything like that in the Metro area, they can receive care for just about nothing, which I think was really cool. Alright, so here is my reference page, and this concludes my clinical presentation. Thank you for watching, and I highly recommend Nashville General Hospital to any of the HIM students wanting to do clinicals. I had a great experience, so thank you.